So let's talk about this. Months and months of talks and negotiations. Finally, the Prime Minister and Premiers are sitting down. We have heard from some of them this morning, the Prime Minister included. What are your takeaways so far? What are you getting out of them?
Well, the leaks that, of course, are planned in a case like this are pointing to a big figure. They want everybody's mind to be concentrated on the $100 billion figure. Big number, actually.
Mm-hmm.
And I think that everybody's trying to place things so that it works well. For example, Premier Legault today announced that he's planning tax reductions. Quebecers are the highest taxed Canadians. Now, everybody's going to be willing to jump at that, saying, but Trudeau's giving money for healthcare and he's giving a tax decrease. So he's going to be very careful to say he's going to agree to all the conditions to make sure that every dollar that flows for healthcare is accountable and you can find that it was actually applied for healthcare. That's the type of thing that has to be discussed. There were a couple of tougher elements involved here. I mean, I thought it was a shame that the First Nations representative, Roseanne Archibald, who complained quite strongly today that having been excluded from the meeting. I don't think it would have taken anything away from this Premier's meeting to have a representative of Canada's First Nations. They've been living these issues for more than decades, for generations, and they deserve to have better consideration than they had. We also heard yesterday from Blaine Higgs, the Premier of New Brunswick, saying he didn't want any conditions at all. His province is in dire straits, so that's just a red flag for the feds to make sure that they put clear conditions on New Brunswick that any money that flows actually goes to healthcare.
So let's talk about that. The conditions that the federal government has been speaking of for a while, saying, OK, we are ready to give you the money, but of course with strings attached. Tom, how do you see the federal government keeping a tab on how this money is actually being used, those conditions being met once the money has been given away?
Well, that's one of the key things that's changed, because you might recall towards the end of the pandemic, with the tragedies we had seen, in particular in Quebec and in Ontario, in nursing homes, the federal government, Mr. Trudeau himself, was talking very clearly about bringing in minimal standards federally for nursing homes. He's backed away from that. There a voluntary set that was published a couple of weeks ago asked straight up if he was going to still do what he had said he would do, and he said no. So he's obviously looking for a healthcare deal. He knows that he's got to call an election sooner or later, and one of the essential ingredients, of course, is to have that healthcare deal. So I think that that's a big change. His openness, Trudeau would have in the past been very categorical and simply said, no question of more private care. But now everyone seems to realize that the system is broken, and it's not just Poilievre that says that. Over the weekend, Jean-Yves Duclos, the federal health minister, used the word broken to describe our healthcare system. So everybody's on the same page. They know that there has to be more flexibility and innovation in how we deliver the care, as long as people, when they go in to get the care, are able to plunk down their Medicare card and they don't need a credit card. I think that that's the bottom line for most Canadians, but there are a lot of tricks involved in that. It's a lot more complicated to do it than to simply say it.
Indeed. And like you said, at least by the looks of it, everybody is on the same page where improvement of the healthcare system across the country is concerned, Tom. Of course, in terms of what provinces need varies depending on the demographics, the population. We've been hearing all of that. But let me ask you politically, Tom, when the Prime Minister and the Premiers do end up reaching a deal, how do you think they're going to be addressing their constituencies about who is taking credit for what here?
I don't think that the public will put up with that sort of stuff right now. And that's the other thing, the most important thing, I believe, that's changed. Here in my home province, Quebec, you're supposed to fight the federal government's incursions into your jurisdiction over healthcare. And Ontario, always saying, it's this and that and the other. Right now, reading the room, the average Canadian voter doesn't want to hear about jurisdiction, wants a result. They don't care about the modalities, the terms, the conditions. They want a result. Right now, the only thing that you're offered in most hospitals across Canada is to be put on a waiting list. Well, Canadians want that to change. We always boast about this great system we've got, but we've got to start looking at this more closely and being honest with ourselves. Our system is broken, and when what you're doing doesn't work, actually, as the saying goes, you got to try something else. And I think that that's where we are right now.
Okay, and lastly, before I let you go, let's talk about that, Tom. Danielle Smith and Prime Minister Trudeau, the meeting before the Premier's meeting together, lots to discuss there, and how, of course, she also wants to talk about just transition with Justin Trudeau. Let's delve into that a little further.
Well, that's a terminology that's often used in environmental circles. You're saying you don't want people to lose their jobs, but as the economy transitions towards a net zero carbon economy, there are going to be big changes, especially in the oil and gas sector. So it's meant to be a reassuring term. Danielle Smith has cleverly done some political judo with that term and says this is an insult. They say they're going to take away our jobs and they're transitioning away our source of revenue for the province. So it's a good political battle that she's looking to have. Yeah. I think that she's wise to have a sit down with the Prime Minister because it gives her a chance to lower the temperature. And I think that probably she's going to have to be on board for the healthcare deal. And if that's the case, of course, having this sort of meeting conditions that a bit for her base back in Alberta because she's got an election coming up in just a couple of months.
Indeed. Of course, we all are watching what comes out of that big meeting and what sort of announcements and details keep trickling. But for the moment, Tom Mulcair, CTV News political commentator and former NDP leader, thank you for your time, Tom.